Are you suffering from blood clots or have a history of heart attacks? Ask your doctor about Warfarin. Warfarin, or Coumadin, is a prescription medication used for treatment and prevention of blood clots that have the potential to trigger stroke, heart attack, or cause organ damage. Warfarin can also be used for pulmonary embolisms, venous thrombosis, and prevention of thrombosis during atrial fibrillation. Warfarin acts as an anticoagulant that causes thinning of the blood. It prevents formation of blood clots by blocking vitamin K-dependent clotting factors, including clotting factors 7, 10, 11, and prothrombin. Before starting Warfarin, tell your doctor if you are taking antibiotics. These may increase the effects. Avoid taking NSAIDs, aspirin, and Tylenol, as these may increase your risk of bleeding. Warfarin is not approved for women who are pregnant or plan to become pregnant, as it has the potential to cause birth defects. Chronic alcohol ingestion may decrease the action of warfarin, and acute alcohol ingestion may increase the action of warfarin. Ingestion of large quantities of food high in vitamin K may decrease the effect of warfarin, including green leafy vegetables like asparagus, beet greens, broccoli, kale, spinach, Swiss chard, and cabbage. Side effects include abdominal cramping, nausea, fever, acute kidney injury, and dermal necrosis. An overdose of warfarin may lead to toxicity that can be treated with vitamin K. Contact your doctor if you experience pain, swelling, discomfort, headache, dizziness, weakness, unusual bleeding including nosebleeds, bleeding gums, and bleeding from cuts that take a long time to heal, pink or brown urine, red or black stools, coughing up blood, vomiting bright red blood, vomiting up coffee ground-like material, or any unusual bruising, as these may be signs of a life-threatening bleeding condition. Your risk of bleeding may be increased if you have hypertension, history of stroke, kidney problems, cancer, or liver disease. While administering warfarin, a nurse should be aware of these factors in addition to signs of bleeding, hemorrhage, and toxicity. Monitor a patient's hemoglobin levels, blood pressure, prothrombin time, international normalized ratio, guaiac positive results in the stool or urine, and hepatic function. These are done to assess the level of warfarin to ensure therapeutic levels to prevent toxicity. A complete blood count should be taken before beginning and during warfarin therapy. Instruct patients to avoid any activity or sport that may result in traumatic injury. A patient taking warfarin may be at risk for ineffective tissue perfusion and risk for injury. Warfarin can help you get back on your feet.